Imagine your brain, the control center of your body, suddenly unable to communicate with the rest of your system. It's a terrifying thought, isn't it? This is the frightening reality of a stroke, a medical emergency that demands immediate attention. Every second counts when it comes to saving brain function and, ultimately, lives. Strokes are more common than we might think, affecting millions worldwide each year. The statistics are alarming, yet many remain unaware of the risks. They can strike anyone regardless of age, background or lifestyle. From young children to the elderly, no one is immune. The good news is that understanding the causes of stroke empowers us to take proactive steps towards prevention. Knowledge truly is a powerful tool in this fight. By learning about the risk factors and adopting healthy habits, we can significantly reduce our chances of experiencing this potentially life-altering event. Simple changes in diet, exercise, and regular medical checkups can make a huge difference. This essay will delve into the different types of strokes, their underlying causes, and the lifestyle modifications that can help safeguard our brain health. Understanding these aspects is crucial for prevention. Remember, knowledge is power when it comes to stroke prevention. The more we know, the better we can protect ourselves and our loved ones. By educating ourselves and our loved ones, we can work together to combat this silent attacker and protect the well-being of our brains. Let's take action today for a healthier tomorrow. A stroke occurs when the blood supply to a part of the brain is interrupted or severely reduced, depriving brain cells of essential oxygen and nutrients. These cells, responsible for vital functions like movement, speech and memory, can begin to die within minutes. The effects of a stroke depend on the area of the brain affected and the severity of the damage. Some individuals may experience temporary weakness or numbness, while others may face long-term disabilities such as paralysis or difficulty speaking. Understanding the mechanisms behind a stroke is crucial for appreciating the importance of timely intervention. Prompt medical attention can minimize brain damage and improve the chances of recovery. Strokes are broadly classified into two main types, ischemic and hemorrhagic. Ischemic strokes, accounting for the majority of cases, occur when a blood clot blocks an artery supplying blood to the brain. These clots often originate from other parts of the body, such as the heart or neck arteries, and travel to the brain. Hemorrhagic strokes, on the other hand, happen when a blood vessel in the brain ruptures, causing bleeding into the surrounding brain tissue. This bleeding can damage brain cells and disrupt normal brain function. Recognizing the distinct characteristics of each stroke type is essential for proper diagnosis and treatment. The next two sections will delve deeper into the specific causes of ischemic and hemorrhagic strokes. Several factors can contribute to the development of ischemic stroke, primarily related to the formation of blood clots and the narrowing of arteries. Understanding these factors is crucial for prevention and management. Atherosclerosis, a condition characterized by the buildup of plaque inside the arteries, is a major culprit. This condition often develops over many years and can go unnoticed until it causes significant problems. This plaque, composed of cholesterol, fat and other substances, can harden and narrow the arteries, restricting blood flow to the brain. The reduced blood flow can lead to the brain not receiving enough oxygen and nutrients, which is critical for its function. High blood pressure, also known as hypertension, is another significant risk factor. It is often called the silent killer because it can cause damage without any noticeable symptoms. Over time, high blood pressure can damage and weaken blood vessels, making them more susceptible to blockage. This damage can lead to the formation of clots that can obstruct blood flow to the brain. Similarly, high cholesterol levels in the blood contribute to plaque buildup, increasing the risk of artery narrowing and clot formation. Managing cholesterol through diet, exercise and medication is essential for reducing stroke risk. Diabetes, a metabolic disorder affecting blood sugar regulation, can also damage blood vessels and increase the likelihood of stroke. High blood sugar levels can lead to inflammation and damage to the blood vessels over time. Additionally, atrial fibrillation, a type of irregular heartbeat, can lead to the formation of blood clots in the heart, which can then travel to the brain and cause a stroke. Regular monitoring and treatment of atrial fibrillation are crucial to prevent such complications. Section 5. Unveiling the causes of hemorrhagic stroke. In this section, we will delve into the various factors that contribute to this serious medical condition. Hemorrhagic strokes, though less common than ischemic strokes, can be equally devastating. They occur when a blood vessel in the brain bursts, leading to bleeding and increased pressure on the brain tissue. High blood pressure remains a leading cause, as it weakens blood vessels and makes them prone to rupture. Managing blood pressure through lifestyle changes and medication is crucial in preventing such strokes. Aneurysms, weakened and bulging areas in the artery walls, are another significant risk factor. These balloon-like bulges can grow over time and become more susceptible to bursting. These aneurysms can rupture under pressure, leading to bleeding in the brain. Early detection and monitoring of aneurysms are vital to prevent catastrophic outcomes. Arteriovenous malformations, or AVMs, are abnormal tangles of blood vessels that can also cause hemorrhagic stroke. These tangles disrupt normal blood flow and can lead to vessel rupture. These malformations, often present at birth, disrupt normal blood flow and increase the risk of rupture. Regular medical checkups can help in identifying and managing AVMs effectively. Head injuries, even seemingly minor ones, can damage blood vessels and lead to bleeding in the brain. The impact can cause vessels to tear, resulting in a hemorrhagic stroke. It's crucial to seek medical attention after any head injury, especially if accompanied by symptoms like severe headache, dizziness, or confusion. Early intervention can be life-saving and prevent further complications. Section 6. Lifestyle choices, a slippery slope to stroke. While some stroke risk factors, like age and genetics, are beyond our control, others are directly influenced by our lifestyle choices. Smoking, for instance, damages blood vessels, increases blood pressure, and promotes clot formation, significantly elevating stroke risk. A diet high in saturated and trans fats, cholesterol and sodium can contribute to high blood pressure, high cholesterol and obesity, all of which are stroke risk factors. Physical inactivity also plays a role, increasing the risk of obesity, high blood pressure and diabetes. Excessive alcohol consumption can raise blood pressure, contribute to heart problems and increase the likelihood of stroke. By adopting healthier habits, we can mitigate these risks and protect our brain health. Section 7. Shielding yourself. Stroke prevention strategies. Preventing stroke involves a multi-pronged approach, focusing on both lifestyle modifications and medical management. Maintaining healthy blood pressure levels through diet, exercise, and if needed, medication is crucial. Similarly, managing cholesterol levels through diet, exercise, and medication, if necessary, can reduce the risk of plaque buildup and artery narrowing. For individuals with diabetes, controlling blood sugar levels through diet, exercise, and medication is essential for preventing blood vessel damage. Quitting smoking is perhaps the single most impactful step one can take to reduce stroke risk. Limiting alcohol consumption to moderate levels, defined as up to 1 drink per day for women and 2 drinks per day for men, can also contribute to overall health and stroke prevention. Section 8. Knowledge is power. Spreading stroke awareness. Stroke prevention extends beyond individual actions. Spreading awareness about stroke risk factors, symptoms, and the importance of timely intervention is vital. Educating ourselves and our communities empowers us to recognize the warning signs and seek immediate medical attention when needed. By promoting stroke awareness initiatives, supporting research efforts, and advocating for improved stroke care, we can collectively work towards reducing the burden of this debilitating condition. Section 9. Taking charge of your health. Small steps, big impact. The journey towards stroke prevention doesn't require drastic overhauls. Small, sustainable changes can make a significant difference. Incorporating more fruits, vegetables and whole grains into our diet, while limiting saturated and trans fats, cholesterol and sodium, can positively impact our cardiovascular health. Engaging in regular physical activity, aiming for at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week can help manage weight, lower blood pressure, and improve cholesterol levels. If you smoke, quitting is the best gift you can give yourself and your loved ones. Numerous resources are available to support your journey towards a smoke-free life. Section 10. Conclusion: stroke prevention, a lifelong commitment. Stroke prevention is not a one-time event, but an ongoing commitment to prioritizing our brain health. By understanding the causes of stroke, recognizing the risk factors, and adopting healthy lifestyle habits, we can significantly reduce our chances of experiencing this life-altering event. Remember, knowledge is power when it comes to stroke prevention. Let us empower ourselves and our communities with the information and resources needed to make informed choices and safeguard our brain health for a healthier, more fulfilling life.